Okay, how to use an intraoral scanner for students, residents, dental practices, and labs. This is something I just created as I'm an auxiliary instructor over at the University of Detroit Mercy School of Dentistry. And all you guys know me as the owner of Griffin Dental Laboratories and a certified dental tech. Um, Let me clear off a couple things here. Um, so I guess the question is why do we do digital scans? And the reason why we use intraoral scanners is that we are trying to gain digital files to send to the lab who will design and fabricate the dental restorations, appliances, devices, and models that the dentist will be able to use, in each individual case. So everything that we do manually, we can do digitally, and it's getting a little bit more and more. Prevalent to be able to do this. So that's why I really made this slides. It's just so that you guys can get a feel for one of the pieces of technology that's out there that we utilize in the dental offices to translate that to the actual dental labs. The question that I always get is like, is it easy to use? And a lot of the students that come in, they're asking, is it easy? Can I do this? You think I really can do it? So the simple and direct answer is yes, it's easy to use. Though just like anything else, it takes practice. Once you got yourself acclimated to using it, you really do get used to, the sequence of things that you have to, pay attention to, like your hand wrist movement, visually observing the scanner monitor while you're actually scanning in the patient's mouth. And then on a couple of the scanners, they have like little ticking noises to where it tells you that the scanner is actually scanning something. So you automatically you can actually hear the things. The observation of the patient is always a must. That's just something that we always do. You pay attention to the patient, but you also pay attention to the screen. You have to go back and forth. You have to multitask in a sense. The next thing is like, can 3D intraoral scanners be used in all areas of dentistry? And again, that's a yes. With everything that I've been doing with the students, and then also when I worked with some of the residents while I was in Kentucky, and the clinical faculty and different things like that, as well as you guys that aren't actually in the school settings, but on the outside that I've been working with as well, is that as 3D technology continues to grow, we're seeing it being used in all areas. So I've been doing scans recently with the students and trying to get them to actually learn how, and I've got over 600 students, but we're learning how to get them to scan the vestibular areas, getting the soft tissue areas, not just the hard tissue, but we're getting the soft tissues for dentures, for custom trays, for occlusal rims and bite guards. The other thing is, and then also for ortho appliances, but then also for using the we're doing each one for the um, for the fixed restorations. So once we can use those for fixed restorations, we're showing them how they can make crowns, bridges, veneers, implants, dentures. We're doing implant surgical guides, showing them those things, showing them that they can utilize these in all different areas. You can utilize it for things that I think one came up was a bone reduction guide. So how to actually utilize those scans once you take them, and then take them over into different software, so that, or even same one, and then actually fabricate different types of appliances, restorations, and things like that. So it's being used in all areas. The other thing, and I want to really point this out, is working with the larger printers and things like that, and the scanners, and using the CBCT scanners. We are also learning how to utilize that to actually get the skulls printed, the mandibles, and that way you guys can actually practice on like drilling prior to the patient coming in for different trauma patients, different cancer patients that are having reconstructive surgery. and even just before you're placing the implants on regular cases. So these are different ways that these intraoral scanners can be used, along with like CBCT scanners. And then on the digital side of dental laboratory, you can actually 3D print these with the technology that we're using. Some of the things for fixed restorations, you're asking if whether or not we should still pack cord. The answer to that really is a resounding yes. We're finding like 000 cords are going to be the best ones that you guys are going to do. So you're going to pack the 00 first, you're going to pack a 0, and then this is just getting your tissue management on key and on point. So what we want to do is get those 00s in first and then the zeros. If we have to go and put in another cord on top of that, then that's something that is okay to do if you need to push that tissue away. And you'll see as soon as you remove like the first cord, so you got a 00 and a 0 on there. Let's say you put a 2 on top of it or a 3, and you take that 2 or 3 out, you're going to see that that tissue actually was retracted enough to where you guys could actually get a good scan of the prep. So those are things that a lot of people are like, oh no, I don't think I need to prep. Well, if I don't need to pack the cord, the whole thing is that, yeah, you do need to pack the cord. The cord is actually inevitably a great resource for you guys, because when you pack that cord, it is taking that tissue away from the hard prep, the tooth structure. It's taken away from that so that the camera can actually distinguish between whether or not there's two different surfaces that it's looking at. If it's together, the camera can't distinguish whether or not that margin is part of the tissue or it's part of the actual the prep that you actually prepped in the beginning. So you really do need to pack cord, and the amount of cord that you pack is going to be seamless in how you guys actually do things with your scanners. The other thing is moisture control. Finding out a lot of students are coming into this with issues about whether or not they need to dry off the teeth, and whether or not and how they're drying off the teeth. The prep that you're drying off. Once I scan like a complete arch, we do like occlusal, lingual, and then buccal. If we're going to do a scan on the lower, for instance, and say that tooth is on the prep is on the lower, and when we come in, you got saliva coming up onto the surfaces of the tooth. Well, what happens is that the computer it scans it, but what it doesn't recognize is that it's a glassier surface. So when you go to look at it on the color version of the digital data, it'll look as though, oh, okay, I kind of got that. Well, change it over to the stone model view of whatever that that case that you just scanned is, and what you're going to start seeing is that it's not clear. The margin runs together with the tissue. So if you're not drying it off, and then when I'm talking about drying it off, you guys got to take and not just take an air water syringe and dry it off. You guys got to take cotton pellets, pull apart a cotton roll and use that. If you don't have cotton pellets, use those cotton pellets, dry around it. If that tooth looks like chalk, I'm okay with that. But if you guys are sitting here and you're drying it off, but then it's, you're looking at it and you're going, oh, that's kind of okay. No, it's not okay. So when I come back in, I want to see crisp lines around those margins. It's the only way we're going to be able to 3D print it accurately and give you what you need. If we're not getting that initially, then that's the problem that's going to plague you guys later on. And a lot of people will fall away from digital dentistry because they think, oh, it's, it don't work. Well, it does work. You have to utilize certain methods, and moisture control is going to be one of them. And cord packing, like I said in the beginning side, that is another thing that's going to happen. That's going to help you guys. The intraoral scanner can pick up undercuts. So when you guys are actually doing things, make sure that it's smooth all the way around. Make sure your surfaces and line angles are you have your parallel line angles. You don't have a lot of undercuts in different areas. Those are going to be what differentiates different types of restorations and how well they come out. Yeah, we can block them out. That's a given. We can always block things out. But you got to think, if you're going from digital scan to digital milling and 3D printing a model, where am I blocking it out at? because it's not one as if we did it manually and we go, okay, well, we're going to go block this out. What'll end up having to happen is that we might have to come back in and digitally block it out in the scan and take away time. And then so now we're adjusting it, and the actual fit of it, we're going to have issues with that. So it's easier for you guys to go ahead. You see it on the screen. Go ahead and, contour your preps back. Make sure that you're getting, you know, the path of draw is correct. Make sure your angles are right. Because you can see it all on the screen. 3Shape is one of the systems that we're using over here. We got several of them, and then I've also worked with a couple other ones, when I was back in Kentucky as well. But you guys know that when you're scanning with these devices, it's showing you magnified, that you can see, what needs to be improved. If it looks like those margin areas need to be smooth, go back and smooth it. The computer will actually tell you like where the undercuts are. It'll show, how close you are to the opposing arch. That's another thing that's on these computers. It'll actually tell you, oh, do you have enough clearance? So all you have to do is utilize those tools within the software that you have, whether or not you got 3Shape, whether or not you got Strawman, whether or not you got, Seric or whoever. Utilize those systems to their capabilities and to the fullest capability, and then you'll be able to get the results that you're actually looking for. But definitely the other thing is, and this is kind of interesting, yeah, it can pick up the undercuts, but also remember that you got to actually smooth out those margins. The margins that I typically like to see, and I think I posted a picture a little while ago, but are a little shoulder on that margin, because when we start doing those knife edge margins, yeah, you can see them, but a lot of times those are going sub G. When you go sub G, it's going to be a little harder for the cameras to pick it up. Now, if you pack in the cord and you're doing tissue control and you're really drying off the tooth and doing the things that you need to do, then you're going to see a lot better quality down in those areas. But if we're not really, if you don't have the capability of getting down in there and you're not accustomed to using the the devices, the scanning devices, all the time, and you're not used to those things, then you're going to want to kind of back off from going sub G on certain things. I know you can't always prevent that, but when you do it, sometimes you might have to switch over to, taking an impression, and then you can even scan the impression. But I suggest like pouring up the model and then scanning the model. It'd be a little easier for you guys, because then you can go back in, cut it out, kind of do your preparatory things in the lab, on digitally lab wise, or actually with a poured model. You can pour it or you can 3D print it and then adjust it that way, and then check and see where your margins are. But anyway, can it pick up undercuts? Absolutely. If you can't see your margins, that's when, like I said, the tissue management is coming into play. You got to put those cords in. There was one doctor that I worked with the other day, and love working with them. And we were with one of the students on the floor, on the clinic floor, and the student prepped around, and we had good shoulder going around. However, there was just one little area that just, it wasn't getting it. But this particular doctor wanted to pack a number 2. He didn't pack a double zero. He didn't pack a zero, anything. So we got to scan, and I said, well, I mean, if that's what he suggests, that's what we're going to go ahead and try. And we've had results to where you can pack one cord and it comes out nice. But however, the resounding statistics is proving that, packing the double zero and the zero, and then if you have to pack like a 2, 3, whatever on top of that, that's fine. But just packing one cord is not going to get you the retraction you need. I'm going to have to come in and then have to rescan it. So I don't want you guys to have to come in and rescan a prep because kind of did, you want to just kind of skip over steps, just because that's what I've been doing. Well, there's times that are changing, and so we have to kind of change the things that we do in order to get the results that we need. So packing a double zero and then a zero and then a thicker cord over top of it, if you're noticing that the tissue's rolling in on top of the margins, those are things that you're going to have to do. The other things is like, I didn't go into this a whole lot, but this is just one of the slides. But 3Shape is one of the ones that we're using. You guys know that I'm iTero lab. We're actually set up under there. I just set up under 3Shape Unite. So if you go on to those, you'll be able to see those as well. But you always know that you could just upload the same files. And excuse me, I got little ones in the background. But you can upload the same files into the actual Griffin Dental Laboratories website. When you guys upload those files into there, you're basically downloading those files onto your computer or your flash drive, and then you're going to take those files and then just upload them into the Griffin Dental Laboratories website. So doesn't matter which system you're using, you can still do that, as long as it's not a closed system. But when you're doing things and you're getting your equipment ready, this is for all of them, really, to be honest. Make sure that you calibrate your scanners. For 3Shape, we have to plug the wand into the computer, of course. We have to remove the protector tip. We have to clean the tip of the scanner wand with the wipes and the cleaners. And we have certain cleaners that you do. It's kind of like an eyeglass cleaner, and it actually keeps it so that it's not getting scratched, it's not getting and you're having nice crisp clear images. We place a black calibrating device on the tip, and that is what we calibrate our computers with. The first one, that is not the color calibration, that's more like the black and white kind, I guess. And to calibrate the scanner, you have to plug the wand into the computer, remove the protector tip, clean the tip of the scanner wand with the wipes and cleaners, and then place the black calibration device on the tip. You have to go into the settings on your icon menu. Go into the settings icon in the menu of the 3Shape software on the dentist side, and then this will get you guys ready to calibrate. You're going to click the trios in the drop down, and it's under the, let's see, and then you'll click the scanner management, which is right under the trios bar on the left hand side of your screen. Once you do that, you're going to click on calibrate the scanner and then click calibrate. You'll hear the clicking sound as it calibrates, so it's kind of neat. And then once it's done, then you'll click next. The tip that I'm showing right here, and I'm going through these pretty quick just because a lot of you guys already know this kind of stuff. But what I want you to know is that, like, these actually have, the silver ones actually have a mirror inside of it, and that mirror is reflecting the camera inside of the wand, and that's what's giving you the image that you guys are receiving on the screens. So you want to be careful when you're changing these tips. They're very fragile. After so many times of cleaning them in the ultrasonics and stuff like that, and the heat sterilizers, they do break down. So you do have to replace them. Look at them. Make sure there's not foggy mirrors, different things like that. I've been noticing that. The cracks in the heads. Those are things that you got to pay attention to. Don't twist these when you put them on. You just put them on in the same direction as the button that you guys are pushing. So make sure you guys aren't twisting them and breaking them. These are just, I mean, it's just things that I just noticed when the students are kind of going through this, and as well as the faculty members. You want to change the silver tip. This is the second part of calibration, but you want to change the tip to the silver tip. The other tip, the gray tip, if you look inside, has a little round dot inside of it. So it's just a protector tip. There's no mirrors in it that's going to reflect. So if you go to try to scan, all you're going to see is a little clear dot in the middle of your scan, and you won't capture any pictures. So you want to insert. After you do that, you're gonna put this little sheath on it. It's like it's a little gray piece that goes over top of this, and then that'll allow you to put the color calibration device inside of that. This goes face up. You're gonna do the A side facing up towards the ceiling first, and then you'll click calibrate. Once you calibrate for the color calibration, then you'll click next. After you click next, you'll face it to with the other side with the B facing up towards the ceiling, and then you'll click calibrate again. After you do that, you remove the calibration device, return it to the plastic box, place the protector tip back on. Always place that protector tip back on. Don't put it in something and then just put it in the box, or just have it just sitting there, because you'll get it scratched. Something could happen. It could fall. Anything. And then when they ask you to save your changes, you just save your changes. So that's pretty much it. When you're adding a patient to the records of 3Shape, this is one of the ones that you can do. Now, each one's going to be different. For you guys that are doing the Intraoral scanners, they have an area as well as where you can add patient data, and I think I'm gonna go in and try and get some slides for that as well, so that you guys can see that. So anybody that has the Intraoral, you guys will be able to see that. Anybody that has the Trios, you'll be able to see this. And then I think we also have one for CEREC, so I can go through and do that one as well. But you're gonna click on add a patient, and you're gonna add patient by the chart number: first name, last name, birthday. Patient email address is where you can put in that information, and then you click add patient, or you can hit add new case. I typically like to click add patient, and the reason why I click add patient is because the when you click add patient, you'll see their name pop up on the top of the window. That means I actually know that I'm in that patient's chart. A couple of times I've actually entered and stuff, and then you'll go in because you're going through doing different patients throughout the day. I mean, we've got, like I said, over 600 students. Well, when I'm doing that and I forget to go ahead and add that patient in, and I just click, you click the icon and you're just going through it, then that would save it into somebody else's file. So it'll save it into the file that you previously were working on. So always make sure that patient name is up on the top of the screen first. That's my opinion as far as how to keep everything separate. The other thing is you're going to choose to send it to a lab. So where are you going to send this digital prescription to? Where are you going to send the files to? You can go into your settings menu, and then you can add labs into that area. You can also go on to connect and add labs that way. The one that I was talking to you guys about before, the one that Griffin Laboratories is set up with, is Unite. So 3Shape Unite is a little bit different. So there are apps within that, and then you can choose the labs that are set up within that, and then you can download those into your software on your side, and so that will automatically send it to that lab. You can manually set it up into your system, or you can do it that way. When you choose different things like that, you're going to also choose what lab you're sending it to. You're going to choose what type of restoration, your alloy type, your shade, your tooth number. All that is going to be in once you get into the system. When you're scanning mandibular arches, I think I kind of hit it on this earlier, but I click on the little icon at the top, and it should be the lower arch. It always usually defaults on the 3Shape to the lower. It's through the lower. I press the button on the wand and make sure the tip is scanning. And you have the silver tip on, okay? Because that's the one with the mirrors in it. You're going to start scanning. For the lower, you're going to start on the occlusal surfaces. You're going to rotate to the lingual and then rotate to the buccal. Clicking means that the scanner is actually capturing the image. So the maxillary arch is the opposite. You're gonna scan the occlusal, then your buccal, and then your palatal. And the reason why you guys are scanning like this, think about it in the sense of what's fighting you the most. The tissue or the cheeks are fighting you the most on the upper, and the tongue is fighting you the most on the lower. So go with that first. Use your wand as your retractor device. If you can't get enough of this data, use your cheek retractors. Get something in there. So like if you guys are doing edentulous cases, use the cheek retractors. Get in there, and you have to do that painting motion to swipe the soft tissue to get into those vestibular areas. Otherwise, it will not it won't capture those images. So those are like some heavy tidbits, I guess you can use. Scanning the bite. So if I'm scanning the bite, if I'm doing, excuse me, if I'm scanning the bite, if it's on the if it's a actual case where it's you have occlusion and different things like that, go ahead and scan one side at a time. You go from usually about the posterior to the anterior region, maybe about the canine area, and then that'll give you your bite. And you use it up in an up and down from maxillary to mandibular in a painting motion, and you go from the posterior to the anteriors. That'll actually help you guys out with how you guys are scanning the bites. Now, if you're scanning a edentulous case, though, you take a bite. They're called bite trays, and you fill the bite tray up with the impression material or the bite registration material, and then you'll get the bite that way. You'll scan that, and then on the list, it'll actually say, do you want to scan the bite tray, or and then you would say yes. So that's for edentulous cases. It has a different sequence of bite scans. The other thing is scanning for protrusive and retrusive movements. So what you guys are going to do is place the actual wand in the back, and you're going to put it as close as you can to the posterior tooth, like the molar, and then you'll have the patient go through the excursive movements. If it's not clicking when you guys are actually scanning or when it's on, then it's not actually taking the video. So in that instance, you really have to pay attention to it, that it's actually capturing the images. Saving the scans, basically all you're doing, there's a color line, tooth with a color line through it on the top of the window of your screen for 3Shape users. And when you click that, you have to wait for it to process. What will appear up under is like a little small blue icon, and you click that one, and then that'll save it to the servers and complete the process. Once you're done with that, it's sending it to the lab. You click, you put all your notes into the area, and I don't know if I can do this real quick. Down at the bottom, right, it says comments and attachments, and what'll pop up to the right hand side, which is what you see, is like a little box. You'll put all of your notes in there, and then you'll also have to select your due date. Also, make sure that if you guys are doing any crown bridges that have shades, make sure to put the shades in there, because if you don't put the shades in there, guess what happens? You won't be able to send that case. Well, you'll be able to send it, but they won't know what shade it is. And the software does actually kind of bounces it back until you put the shade in, or you can select send anyway. So those are little things to note. The other thing is, like, once you save the design in the software, you can export it to your labs. You can actually just save it to your desktop and then send it to the lab. Like I said, you can put it into Griffin Dental Laboratories website. That's one thing, right? So, or if I'm on certain platforms, then you can go ahead and send it through those platforms. Sometimes that makes it easier. However, sometimes they're requiring us to sign up with all these different accounts. Well, we have to pay for those membership accounts. We also have to pay for the amount of pulls that we're pulling from our system to do that. So your prices can go up based off of what the cost is to us to pull those files. So to me, I would prefer it if you guys were sending those files in the Griffin Dental Laboratories website, so that'll actually help you guys. In the end, the 3D scanner helps certified dental technicians like myself to be able to deliver restorations to dentists just like you, so that you can make the patients aesthetically more pleasing restorations, but also give back the function that they require, and it gets the case to the lab a lot quicker. This is one of my students right here. I was doing a case with him, Alinde. Esquivel. So he's gonna be going into I think he's going into the army after this. But he is phenomenal. He's been doing a lot of restorations, just learning, trying to, get his practice in, trying to figure out what's best. Worked with him on doing 3D scan, or the intraoral scanning, both with CEREC and 3Shape, and then showing them why you need to round out your angles, why you do need to create those central fossa areas, so that when I receive a case and I want to put anatomy into a case, if you don't give me the proper amount of space occlusally and reduce it then you're going to have issues with the anatomy that you receive back from the lab. So they're liking those kind of things that that I'm telling them. Also with the intraoral scanning, how to actually to use the intraoral scanners, but also how it relates to what the labs are doing on the outside. You know, we have the we have the form lab printers at this school. We had the Prodways over at UK, and then I also have Creality and some other ones. So, oh, and Rapid Shape, we did Rapid Shape too. But so utilizing all the is for them to be able to see all the things that we utilize in the lab, they can appreciate what it is that we're doing and what we have to go through in order to get the restoration the right way. So you know, there's so much that goes into it, and there's so little time that we can actually explain to everybody what it is that we're doing in the lab and how we need chairside to, you know, have a certain way before it gets to us. So just like when we take impressions, like the regular PVS impressions, we have to do certain things. We can't send it if we can't read the margins and different things like that, because if you can't see it, the lab can't see it. But the same instances apply when we do digital. If the lab can't see it, then on the screen, then we can't make it the way you need it to be made. So rounding out line angles, being meticulous about the shape, the contours, pushing that tissue away. I think that biggest thing is pushing the tissue away and actually being able to capture that, capture the impression. The other one was actually just going in and being able to capture edentulous areas. And that is, I mean, it's really tedious, but once you get it, you really do get it. Using the cheek retractors to open up the arches and or open up the mouth and keep those lips away from the arch when you're doing those edentulous scans is imperative. So hopefully this actually helps you guys. Again, you guys all know who I am. I'm just, you know, Vernice Griffin. I'm a certified dental technician and the owner of Griffin Dental Laboratories. Um, I've been with National Association of Dental Laboratories, Texas Board of Dentistry, Board of Dentistry, Texas Board of Dental Examiners, and an auxiliary instructor at the University of Detroit Mercy School of Dentistry, located in Detroit, Michigan, my hometown. Um, I've also worked chairside. I've had a lab open since 2006, and I've worked with oral surgeons, orthodontists, general practitioners, prosthodontists, students, residents, dental manufacturers, and a host of other dental professionals. I'm trained in 3Shape scanning, CEREC scanning, milling, Ceramill, 3D printing, with both industrial grade 3D printers like Broadway's, smaller 3D printers like Rapid Shape Creality and Form Labs. And I'm knowledgeable in a lot of areas of 3D printing materials, from Drava and Formlabs, as well as from Emacs, Avoclar, and things like that, and AirCeram. I mean, there's so many different areas that I've been in. It's kind of hard to mention them all, but know that I continue to advance in different areas because I want to give that information back to those that are working with me and working with my lab, and then also the ones that I'm teaching on a daily basis. So this is just my contact method as usual. The second email address that you guys see on there is actually my University of Detroit Mercy um, email address, but again, you can always reach me at the Vernice at GriffinDentalLaboratories.com. And my phone number, 859-270-4823, is usually available. You know, if I don't answer you right away, I'll get back with you. Usually I'll tell everybody, just go ahead and text me. I'll usually get back with you if you're going to use that method. The 1-800 on the website is still available, but you can go to www.GriffinDentalLaboratories.com. Go to HTTPS, that's more the secure site. And then also you can find me on Facebook, Instagram, LinkedIn, YouTube, and all the other social medias out there. And right now, since I'm doing this transition, I'll be here in Detroit, but you can send anything through my P.O. box. until I get everything up and running again. But hopefully this helped you guys. I'll try to come up with a couple more videos that will help you guys to actually understand a little bit more about what I'm teaching the students and what we're kind of going through on a daily basis. And if they're on here too, you'll be able to see them, and they'll probably get on here. And I'm gonna try and open up the platform to them as well, and then that way once they're on there they can actually gain a little bit more knowledge, and sometimes they just need a little extra push on some of these so that they can learn it before they get out and practice just like you guys. So that's why these videos, I want to go ahead and make these videos for you guys so that you guys can always have this at your disposal, as well as when when you go out to practice, and also when you guys are just and if you're in that learning stage, it's always there and it's always available. So if you need like the a PDF of these PowerPoints, I have those available. And you could just email me at bernice@griffindentallaboratories.com and ask for it, and I will get them out to you as soon as possible. Hopefully I might even make a website up to where you guys can just download them from there, like like I normally do, and then that way it'll save a little time, so you can just go on there and download it, and I know who's downloading what. That way I can keep track of you guys, because it's good if I know who actually has the information. So if we start talking about something, you guys I already know that part of what I actually do, or what I'm having to explain to you guys, and the resources will be available to you guys. So anyway, happy holidays. I know it's getting into Christmas, and I hope everybody's doing well.